Today, I will be talking about one of the elements in nursing management, which is planning. We all know that the nursing management includes planning, organizing, staffing, directing, and controlling. It is primarily the task of the manager to plan, organize, staff, direct, and control available material and human resources in order to provide effective economic care to patients. Planning is deciding in advance what to do, who is to do it, how to do it, when to do it, and where to do it. Planning involves a choice, a necessity to choose among the alternatives. There are two types of planning: the operational planning, or the short-range planning, and the strategic planning, the long-range planning.
There are four planning modes. First is reactive planning, or past-oriented. There is an active attempt to turn back the clock to the past. The past, no matter how bad it is much preferable to the present. Second is inactivism, or present-oriented. There is an attempt to preserve the present. The present is much preferable to the past and the future. Third is preactivism. In preactivism, there is an attempt to predict the future and then to plan for that predicted future. It utilizes technology to accelerate change. Fourth is proactive or interactive planning. It considers the past, present, and future. There is anticipation of changing needs. Knowing the four planning modes, what is your planning style? How do you plan for the day? How would you describe your planning? Are you a reactive planner, an activist, pre-activist, or a proactive planner? Let's now proceed to forecasting. Forecasting is an estimate of how a condition will be in the future. A common mistake for nurse managers is the failure to complete proactive planning. Forecasting routes. Forecasting routes includes top-down, where international and national events affect the future behavior of local variables. Another is bottom-up, where local events affect the future behavior of local variables. Strategic planning. Strategic planning is a tool for organizing the present on the basis of the projections of the desired future. A roadmap to lead an organization from where it is now to where it would like to be in 5 or 10 years. This is the SWOT definition. A sample SWOT of Coca-Cola includes the following. There are simple rules to follow for a successful SWOT analysis. Be realistic on strengths and weaknesses of your organization. Be specific about what you want to accomplish. Keep it short and simple. Another is the Balance Scorecard, which was developed by Robert Kaplan and David Norton. Huston identified factors that will influence the future of healthcare. These are the following: robotic technology, biometrics, a growing elderly population, an aging workforce, internet and electronic access. Planning has its hierarchy: the mission, vision, philosophy, goals, objectives, policies, procedures, and rules. The vision explains future goals or aims of the organization. According to the Alliance for Nonprofit Management, if strategic planning is the blueprint, then vision is the artist rendering of that blueprint in the organization. This is the vision of Trinity University of Asia Graduate School. Mission identifies the reason that an organization exists. It is the highest priority in planning hierarchy because it influences the development of an organization's hierarchy. This is the mission of the Trinity University of Asia Graduate School. Philosophy flows from the mission statement. It involves organizational philosophy, nursing service philosophy, and unit philosophy. However, individual values may be in conflict with those of the organization. Confusion, anxiety, interpersonal struggle will lead to job stress and dissatisfaction, internal conflict, burnout. This will happen when the philosophy of the hospital is not consistent with your own set of values. Have you ever experienced or been in a situation where your personal values differ from the institution? It is important that nursing managers must recognize that closely held values may be challenged by current social and economic constraints. Philosophy statements must be continually reviewed and revised to ensure ongoing accuracy of beliefs. Let's now proceed with goals and objectives. Goals are the desired result towards which effort is directed. It is the aim of the philosophy, and it can have multiple objectives. On the other hand, objectives are more specific and measurable than goals. It identifies how and when the goal is to be accomplished. These are the examples of goal and objectives. Policies are statements of expectations that sets boundaries for action taking and decision making. Procedures is the process to implement a policy, generally found in manuals at the unit level of organizations. What is a planned change? This results from a well thought out and deliberate effort to make something happen. The deliberate application of knowledge and skills by a leader to bring out change. Kurt Lewin studied the development of change theory. According to him, three phases through which the change agent must proceed before a planned change. First of which is unfreezing. The change agent convinces the members of the group to change. People, on the other hand, become discontented and aware of the need to change. Second is movement. The change agent identifies, plans, and implements. The change agent must remember that any change must allow enough time for those involved to be fully assimilated. Third is refreezing. The change agent assists in stabilizing the system change so that it becomes integrated into the status quo. Identify a change that you would like to make in your personal life. List the restraining forces keeping you from making this change. How can you make the change possible? Always remember that resistance is natural and expected response to change. You must encourage subordinates to speak openly to identify options and overcome objectives. The leader-manager must act as role models to subordinates during change process. They must attempt to view change positively. Critical that managers not view change as a threat, and they must embrace it as a challenge. Planning also involves time management. Time management is making optimal use of available time. One way to reduce stress and increase productivity. Also allows individuals to spend time on things that matter. The three basic steps in time management. 1. Allow time for planning and establish priorities. 2. Complete the highest priority task whenever possible and finish one task before beginning at another. 3. Reprioritize based on the remaining tasks and on new information that may have been received. These are the 5 priority setting traps according to Vaccaro. There are 3 categories of prioritization. First is do now. Reflects day-to-day operational needs. Second is do later. Do not have immediate deadlines. Third is don't do. Better accomplished by someone else and usually outdated. Time wasters includes technology, socializing, paperwork, and poor filing system. There is also what we call the fiscal planning. It is perceived to be the most difficult type of planning. Difficulty with forecasting costs and projected needs. These are the steps in budgetary process in which the nurse manager can follow. First, assess what needs to be covered. Second, develop a plan. Third is the implementation, and fourth is the evaluation. Thank you for listening to the discussion. I hope you've learned a lot. Always remember, he who fails to plan, plans to fail. These are my references.